Women are the backbone of society. Some run businesses, others work as employees, and all mothers are the bedrock of their family. But women in low and middle income countries face a much higher risk of fatal disease than their peers elsewhere. The vast majority of cancers now occur in regions where treatment is the least accessible. Women diagnosed with cervical cancer are often in the prime of their life as main carers and increasingly breadwinners of their family. Their death has devastating consequences for their children, their business and their community. The United Nations has set as one of the 17 Sustainable Development Goals the aim to eradicate these avoidable deaths by increasing the availability of the best treatments. The technology exists today. Can we spread it for a safer tomorrow? In this Indian town alone, the city of Visakhapatnam, there are an estimated 10,000 cancer cases a year that could be treated with the right access to radiotherapy.
For women, the number one cancer in India currently is breast cancer. The number two is cervical cancer. The cervical cancer is usually seen in third or fourth decade, and then the second peak is usually seen in fifth or sixth decade of life. The younger women are more commonly seen affecting with cervical cancer in rural background because obviously the age of marriage is very early in rural India. She's supposed to take care of all the family members and upbringing of the children, as well as to some extent the economy by going to the fields to work in rural India. And in urban, she would also be involved in doing some part-time jobs to fetch more money for the family. So you can imagine if she dies of a cervical cancer, all the sections of the family upbringing is affected very badly.
And those avoidable tragedies are far too common in India for a number of reasons.
The data says that 60 to 70% of the cervical cancer patients diagnosed are advanced stages at presentation. The cure rates come down as the patient have more advanced disease. There are hurdles in giving adequate treatment for these patients, and this is directly related to the availability of radiotherapy facilities. From rural background, patients' accessibility to state-of-the-art treatment facilities is very, very limited. The need of the hour in low-middle income countries where cervical cancer is a major health problem is an affordable cancer treatment, especially in terms of radiation for these advanced cervical cancers.
Medical device manufacturer ELEKTA has set its sights on the same goals.
ELEKTA was founded almost 50 years ago. It was a professor in neurosurgery, Lars Leksell, and also his son has spread this technology around the world. And we are located in 40 countries around the world. So it's a truly global, but also a very personal mission for us as a company and all our employees. And every year, 10 million people dies of cancer. And 70% of those 10 million people are in low and mid-income countries. Our mission is helping clinicians improve and save patients' lives around the world.
ELEKTA is a global leader in the development and production of equipment for brachytherapy, a treatment that makes a huge difference to survival rates of cervical cancer patients.
Brachytherapy is a form of radiotherapy where a source is getting close by to the tumor and also called internal radiotherapy. An applicator is brought into the body. For cervical cancer, for instance, through the vagina, and sometimes small catheters are being used. Then there is an image made, either for CT or MRI, and the physician uses that image to do the so-called treatment planning. The physician will indicate where the dose should be put, the radioactive dose that kills the tumor, and which healthy tissue should not receive any dose. Then the applicator It's coupled to the afterloader. And the afterloader is a robotized system that houses a radioactive source, a very small radioactive source the size of a rice kernel. Then the treatment plan instructs the afterloader to send out this radioactive source to the applicator into the body of the patient according to the treatment plan. The radioactive source stops at certain positions for certain time and forms the dose that the physician intended to deliver. At the end of the procedure, the source is retracted back into the afterloader, so there's no radioactive source remaining in the body after the treatment. This can be repeated about 2 to 4 times, either on consecutive days or in 1 to 2 weeks.
Brachytherapy is a crucial component of Dr. Manishetty's arsenal to cure his patients.
So brachytherapy for cervical cancer is a very vital component for treatment of cervical cancer. This amounts to more than 50% of the treatment required to cure cervical cancer patient. If this brachytherapy is not available, then the control rates or the outcome is compromised by as high as 40%.
Lalitha and Suravathi have both been cured of cervical cancer by treatment that involved brachytherapy.
రాకముందు నేను పనిది చేసుకొని పిల్లల్ని స్కూల్కి పంపించుకొని ఏదో రూపాయి డబ్బులు మిషన్ కుట్టుకుంటేదాన్ని సార్. నేను చాలా బాధపడ్డాను. నాకు క్యాన్సర్ రావడం ఏంటి, నేను బాగానే ఉన్నాను కదా అని నమ్మలేకుండా చాలా బాధపడి ఏడ్చాను. అప్పుడు హోమీ బాబాలోకి వచ్చి అన్నీ తెలుసుకొని డాక్టర్లు అన్నీ ధైర్యం చెప్పారు. నీకేం అవ్వదమ్మా, చిన్నది, ట్రీట్మెంట్ చేసుకుంటే తగ్గిపోద్ది అని చెప్పారు. 5 వారాలు కిమో పెట్టుకోవాలన్నారు సార్. 25 రోజులు రేడియేషన్ పెట్టుకోవాలన్నారు సార్. లోపలికి 3 టైమ్స్ నెక్ పెడతానన్నారు.
నా పేరు సూర్యావతి కంద. నా వయసు 39. నాకు ఒక బాబు ఒక పాపనండి. ఆయన గారు పాల వ్యాపారం చేస్తారండి. డెఫినెట్గా నా మీద ఆధారపడి ఉన్నదండి. నాకు కూడా ఈ హెల్త్ ప్రాబ్లం వచ్చిన తర్వాత నన్నైతే ఎవరో చిన్న చూపు చూడలేదు. అందరూ బాగుంటావు, పర్వాలేదు అని ఎంకరేజ్ చేశారండి. కానీ నా మీద నాకే నమ్మకం, నేను వేస్ట్, నా ఇంట్లో ఇంతవరకు కష్టపడి సంపాదించిన అంతనే మీ ట్రీట్మెంట్ వల్ల కూడా నేను కోలుకుంటానన్న నమ్మకం నాకు వచ్చిందండి. నాకు ట్రీట్మెంట్ పరంగా 3 విధాలుగా ఇచ్చారండి మీరు డాక్టర్ గారు ట్రీట్మెంటు. ఒకటే 23 రేడియేషన్ ఇచ్చారండి, 4 కిమోలు పెట్టారండి. 3వది వచ్చేసి బ్లాకీథెరపీ చేశారండి. బ్లాకీథెరపీ అయితే నేను భయపడ్డాను. సార్ నీకు 80%, 75% తగ్గిపోయింది, ఉన్న 25% తగ్గుతుంది అనేసి ధైర్యం చెప్పి ఈ ప్రొసీజర్కి నన్ను ఒప్పించారండి. దానివల్ల ఈ 4 బ్లాకీథెరపీలు అయిన తర్వాత కూడా నాకు బాగుంది. దానివల్ల నేనేమి ఇబ్బంది పడలేదు.
After brachytherapy treatment, patients can quite quickly go back to their family. When brachytherapy is combined with other treatments, the frequency or the doses for those treatments can be lower. This results in less hospital visits.
మళ్ళీ నేను బ్రాకీథెరపీ చేయించుకోనంటే ఇంకొక 2-3 నెలలు కీమోథెరపీ ఇస్తారు, ఒక 2 నెలల వరకు అన్నా ఇస్తారు. దానివల్ల ఇంటి దగ్గర పనులు ఆగిపోతే నాకు కూడా నీరసం పడిపోతాను నేను. దానివల్ల ఇంకెందుకు 2 వారాల్లో అయిపోతుంది కదా అనేసి నేను బ్రాకీథెరపీయే తీసుకున్నాను.
ELEKTA develops and produces its brachytherapy solutions here in the Netherlands.
We have about 200 people working here, mostly to support our global brachy business. We do things like R&D, where we collaborate with important hospitals, but also develop our software applicators and afterloaders. We also do our production here, and that's done versus very strict medical device regulations and tested as well. And we ship worldwide to our customers. Besides that, we have training and education that we support from our expert center here in Venendaal.
Education of medical staff is just as important as the modern machines themselves.
ELEKTA has founded the Brachy Academy. The Brachy Academy is a peer-to-peer training platform. In that peer-to-peer training, the whole Brachy team is being trained by colleagues. We focus on low and middle income countries because it's important that in those hospitals, professionals from other countries can, in local hospitals, provide the team with the training. By doing so, we expect that also the uptake of brachytherapy as a treatment, with more units, more trained staff, and access to the hospitals, is increased.
ELEKTA's mission is firmly rooted in the UN's Sustainable Development Goals. Therefore, it also includes sustainability across their entire operation.
Our key Sustainable Development Goal is access to health. But that needs to be built on a foundation of clear focus on sustainable production. So the environmental impact from our operations need to be reduced as much as possible. So that's one pillar. The second pillar is taking care of our people, taking care of all the stakeholders around us in the right way and being a responsible employer. It's also about high business ethics. So we do business in an ethical and responsible way. So that's the three pillars we have as the foundation for our target to bring radiation therapy and healthcare to all.
But to achieve that goal, the treatments need to be effective and affordable. Brachytherapy is both.
The initial investment capital investment is very, very low. If you shift from conventional brachytherapy for cervical cancer to image-guided adaptive brachytherapy, you are improving the local control rates from roughly around 50% to almost 80 to 90%. This has an economical benefit. Whatever investment we do in this newer technology, that is 3D image-guided adaptive brachy, we recover that money within 2 to 3 years of investment.
Modern, affordable brachytherapy has saved the lives of Lalitha and Suravethi. Like them, many more women and families could be helped immediately.
ఇప్పుడు ఈ ట్రీట్మెంట్ అయ్యాక నేను కళ్ళు తెరుచుకున్నాను సార్. నేను నా పిల్లల్ని చూసుకోగలుగుతున్నాను సార్, నా భర్తను చూసుకోగలుగుతున్నాను సార్, నేను నా వాళ్ళని చూసుకోగలుగుతున్నాను సార్. నా ట్రీట్మెంట్ అయిపోయింది, నేను కొంచెం బాగా ఉన్నాను సార్.
నేనైతే తొందరగా కోలుకున్నాను. నా వరకునే ఎంతన్నా నేను కోలుకున్నానో అది నాకు చాలు. నా తోటివారు ఎవరైనా ఇలాంటి ఇబ్బంది పడుతుంటే వాళ్ళకి కూడా ఈ విధంగా చేయించుకోమని చెప్పాలి సలహా అని ఉందంతే.
The technology of brachytherapy should be available to each and every corner of the country in all low middle income countries so that more and more cervical cancer patients can be saved and cured.
And we have already come a long way towards achieving that goal.
We have been able to double the number of life-saving and curing machines around the world. We want to continue on this growth trajectory. So governments and healthcare system needs to invest in affordable cancer care around the world.